Apomuden so afọ mo nyafo kwakwa jimamenu kire mu se na katweka bi eda anasefo ene aban no ntenso wo wiesuku obefo mo na so abadada ni twam wo mfimpi mienu ni edu enan mu enti mfimpi mienu ni edu enwotwe ekono agisa anasefo na fa nkrata ni twerɛdua etwere kopa adwuma ewa yaresabea hodo ni mu wasisesi na aban na bono modene afa anasefo beye empem aduanan ahanum aduonum ensia ani nyada eda dipefe se aban no ebo ne homodene wasisesi dia nyokofa bi da enna aban eni ankrankra na sefo school no entem wonu mo akwa ankrankra school no awie no wo mo kan ru se aban ni sika ode be fom animanimu ya mo makwa ye adwuma.
The nursing training system in our country has one part owned by the state, and we call them the public nursing training institutions, the government ones, and then the advent of the private schools. Quite a large number of them who attended private schools, I wouldn't say 100%, but I'm stressing that a number of them are students who may have applied to go to the normal health training institutions owned by the state, but for some reason couldn't get admission. Then you find them pushing themselves because of their anxiety, their willingness to be trained as nurses to seek opportunities elsewhere, so they end up in their private schools. Unfortunately, those who attended the state-owned health institutions were being made to sign contracts with the state. We call them, they get themselves bonded with the state, so that the state subsidizes your education, and the implication of the bond will have been that when you finish school, government will also force you to work for government over a certain number of years before you are allowed to exit state medical institutions. That sort of contract seems to have been misinterpreted. So when government was training and private sector was training, with embargo on recruitment, you could see what happened. We are trying to assist, though government has no legal obligation, not a commitment. We have constraints, and we don't control, how do I call it, the budget. The finance minister is also very conscious not to overrun compensation in its implementing the budget, because we all seriously are working to stabilize the macro environment, to bring sanity into management of our finances. And therefore, I sit here as a minister, I cannot go ahead to recruit when I know very well that there is no cover to pay for them.